Hi everyone, this is chapter 2 in your basic instrument book. You can follow along with me on page 6 for basic instruments. So the instruments that you learned last semester is pretty much what we're going to be going over very quickly. And you're seeing already out in clinical that you're seeing a lot of these instruments are in various different kinds of trays. So you're going to be commonly seeing these over and over again throughout your career. Okay, first we're going to start with the electrocautery pencil. This is, if you remember in supply class, we went into the OR and there was a Bovie unit, a big blue machine that this plugged into. We talked about how it was a monopolar device and how with monopolar you had to have a Bovie pad on the patient as a grounding site. So what happens is they plug this into the blue unit. This comes sterile, and the electrocautery heat comes out of this pencil into the patient, through the patient to coagulate tissue or stop bleeders, and then out through the grounding pad, through the patient, back into that Bovie unit. So it's called, if they call down from the OR, they might call down and say, I need an ESU pencil, I need an electrocautery pencil, I need a Bovie pencil, I need a Bovie. So those are the kind of terms that the OR is going to be calling for. Okay. The harmonic scalpel. So this is a harmonic scalpel is a grasping instrument. It uses ultrasonic energy. So this tip that you see here, they can come in different size jaws and different lengths. This tip, this whole piece right here is disposable. It comes sterile, wrapped sterilely, but it is thrown away after it's used. Then it has a cord that plugs into this bottom half, and you need a wrench in order to crack down on that cord and connect those two pieces. So that cord does go through the sterilization process. And then the end of the cord is handed off to the circulator and she plugs it into the unit. So this is called the harmonic scalpel, and it's surgeon preference. If they'd rather use the ultrasonic waves as opposed to the monopolar Bovie, they can do that also. Next, we have our clamping and occluding clamps. So we learned that whole family of clamps that semester. Remember, starting with the little baby clamps, moving up to the teenagers and the mom and the dad. Okay, so the Halsted forceps, that's the smaller of the clamps. And remember, all of these clamps. So next is our cryo clamp, and our cryo and our Kelly. The Kelly had the half serrations, but any of these in the surgery, they could say, I need a stat, I need a clamp, I need a snap. They call them all these different slang words in surgery. So if they do call down and they say, I need a cryo, I need a Kelly, I need a small clamp, then you're going to know, well, how small do you need it? Do you want a little Halsted or do you want a cryo? So these are all clamping and occluding. There's our Kellys. Our Rochester Pion is another clamp, but it's the bigger one. So now we're getting to the bigger one. I think like this was the mom, that was these were the teenagers, and the kid was the Halsted, and then there was one more smaller one. The Mosquito was smaller than the Halsted. Okay. So Rochester Pion, I just want to let you know that there's other names for this one too. They can call it a Mayo clamp, a Mayo Pion. So if they call down and they say, I need a Mayo, you know that they're talking about this Rochester Pion forceps. The Carmalt forceps. So the Carmalt, other than looking at the jaws and seeing that their serrations are slightly different, and just for pages, we are on page 9 now. And so the biggest difference with this, it's used for larger vessels, but the serrations run the length of the jaw. So if you can see compared to these serrations, how they kind of run up and down the jaw on the Rochester Pion and the Kelly and the Cryo, with the Carmalt, it runs all the way down. Okay, so that's the Carmalt forceps. The mixture, the serrations are such as that as the Mayo Pion and the Cryos, but this is a right angle. So the mixture can also be called a right angle clamp. The Atzen forceps. The Atzen also has a curve to it, but not as drastic as the right angle or the mixture. But the Atzen has a few different names too, and we're on page 10. It can be called a Schnitt, tonsil forceps. Give me an Atzen, give me a Schnitt, give me a tonsil. So any of those you'll hear the OR call down for. Next, we have our straight Mayo scissors. These are used primarily to just cut suture in drapes. Our curved Mayo is used for the heavier tissue. Okay, our Metzenbaum is for the thinner tissue. The Lister banded scissors, those were made typically to cut dressings off. If you see the tip of them where there's this blunt tip, that tip would be closest to the skin. So when they're cutting off the dressing, it's not harming the skin in any way. Okay, our wire scissors. These are typically used for any wires, such as arch bars. If anybody's ever had their mouth sewn together, you can cut the wires with that. Our knife handles. Our number 3 knife handle that fits the 10 blade. And we're on page 13. 10 blade, 11 blade, 12 blade, 15 blade. The number 3 knife handle and the number 7 knife handle both fit those blades. And you'll see these are like a key. Okay. And then there's a long number 3 knife handle for when we're getting in deeper areas. The number 7 knife handle is for when we're in delicate, more narrowed areas that we need more room to maneuver in. So you'll see that the handle is thinner and it's not as thick as that number 3. Okay, but all of those keys will fit into this lock. These all have certain fittings. So this won't fit onto a number 4 knife handle. It will only fit onto a 3 or a 7. Okay, so this is our number 10 blade, our most common blade, cutting and dissecting. Our 11 blades, which can be used in lap colees or just where they want to make small, fine incisions. Our 12 blades, those are more used for tonsils. Then we have the 15 blade, which can also be used just for making smaller incisions. The number 4 knife handle, that only fits 20 size blades. So this little key area here, it fits differently into the 20 blades here. The lock hole is bigger. So you can't fit this onto a number 3. Okay, our beaver handle, these are more for plastic surgeries. And they use little tiny blades if they're doing ENTs, or eyes or neurology or small orthopedic procedures, they might need even a smaller blade with a smaller handle. So that's when they would use these. These are 2 pieces, so you'd have to make sure that you don't just send this piece up. It can't work without the little attachment on it. Okay, they're Adson tissue forceps. These are all used on skin primarily. They're grasping and holding. This one happens to be a plain Adson tissue or smooth Adson tissue. It does have serrations, but it doesn't have any teeth at the tip of it. Then we have our toothed Adson forceps. That you see, it looks just like the smooth, except it has a little tooth right at the end, a little rat tooth. And I say rat tooth because it's different than these brown teeth. See how the brown is multiple teeth as opposed to just that single little rat tooth? Okay, not to be confused with the rat tooth forceps. All right, then we have just a plain tissue forceps. Sometimes we just need a plain tissue forceps. Maybe we want to put some dressings on, okay, grasping and holding. Then we need a toothed forceps. And as you see, these get longer as they go. Oh, skipping pages here. Now we're on page 20. These are used when we want to hold tissue. And we're getting into deeper tissue now. So these aren't typically used on skin, but once we're through the skin into the deeper tissue. DeBakey tissue forceps, usually we're through the peritoneum or we're working with blood vessels because these little fine, I don't want to call them teeth, but they are teeth, but they're very delicate teeth. They're blunt. They're like a blunt tipped. They're more like serrations than teeth because they can pick up bowel and it won't poke a hole through the bowel. So these are typically used in bowel surgery or any kind of delicate surgery. If you're like working with GYN, they might use them on the fallopian tubes, or if they're working in cardiovascular, they can use them on vessels and such. Okay, bony tissue forceps. Now we're getting into the heavier tissue forceps. Heavier the forceps, the heavier the tissue we're going to use it on. And this has that rat tooth at the end of it too there. So you'll see this is a bony, and it's just surgeon preference as to which they'd like to use. Then we have the Ferris Smith. You'll see these used too in GYN and orthopedic surgeries. Our singly tissue forceps, these were typically used in thoracic surgeries to grasp lung tissue. But I've seen them used in OBG, urology. Okay, our Russian tissue forceps, these are also an atraumatic tissue. They do get to have a fine grip on them, but they're not going to cause harm to the tissue. The Russian tissue forceps kind of looks like a cat paw at the end. That's another name for them, but some people will call them. Okay, our towel clips. On page 23, this is our Bacchus towel clip. Bacchus, penetrating, meaning once you put that through something, it's going to cause a hole. So it's traumatic. It's going to puncture. Then our non-traumatic, our non-penetrating towel clip. This is what we're going to use on our drapes and such. We don't want to use the penetrating one because we'd cut a hole right through our sterile drape and then our drape wouldn't be sterile anymore. So there's different types of towel clips. Then we have our sponge forceps, and we're on page 24. They'll call these sponge forceps, give me a sponge stick, give me a ring-handled forcep. So they could call down for many different names of these sponge forceps. In laparotomy surgery, when we're working in the abdomen, we put a Raytex sponge on the tip of this, and we use it for surgical blunt dissection. Okay, Alice forceps. This is another grasping and holding forceps on page 25. I know this gets confusing to some because it looks like a clamp, right? It's got the finger rings like a clamp, but really it's not a clamp because it's not occluding anything. It's just using, it's another way to, a forceps, another way to pick up tissue. And you see it has these little teeth at the end, and they're usually atraumatic. They're not going to hurt the tissue. Next is our Babcock. This is another grasping and holding forceps because the tip is very delicate. It's atraumatic. We use it to pick up bowel or use it in OBGYN to be very gentle around the fallopian tubes, things like that. Coker forceps. Now this is a traumatic forceps. This has that rat tooth and this could puncture, so you'd never want to use it in the bowel area, right? On heavier tissue, it's fine to use it on, and they sometimes will use it when they're going into the belly. Once they get to that muscle and fascia, they want to get a good grip on the muscle and fascia, so they like to use these cokers so that they don't keep ripping through the tissue, that it will just hold on to the tissue tight. Our Army Navies. So now we're into our retractors. Our Army Navies are very common. You'll see these in minor trays, in vascular trays, in major trays. They're for retracting and exposing. They have one short end and one long end, and they come in pairs. Our Gauntlet retractor, that's a double-ended handheld retractor, and it's got the curved blades on the end. One is smaller than the other. A Sun retractor, that's got the little rake on one end and the little blunt end here, that they go in opposite ways. Then our Murphy retractor, which, as we know, it looks like a rake retractor, but the tip of it, it's called, because of that handle, they call it a Murphy. But it is, they might also call it just a rake. And depending on what you have in your tray, you give them, if they say, give me a rake and you hand a mat, it's going to be fine. Or if they say, give me a rake and you hand a mat, it's going to be fine. Okay. They might say, give me a longer rake, or not a longer rake, give me a wider rake. So the next one is our Volkmann retractor. The Volkmann can also be called a rake, and as you know, they can come in different widths. Ribbon retractor. We also call these malleable retractors because they can bend. It's a handheld, bendable retractor that is very commonly used in surgery, and it does come in different widths. This is a wide one. The Parker retractor, that's just a double-ended blunt retractor. You can use it on both sides. The skin hook. Now this is a traumatic retractor. This, you can get hurt with this because it's very sharp at the end, but it's used for retracting and exposing. And they do have, like, you remember the double skin hooks? So there's single skin hooks and double skin hooks. This is a self-retaining retractor. It's our Wheatlander. This one happens to be sharp, but they do have blunt ones, if you remember. Our Gelpi retractor. Our Gelpi was the one that just had two little horns here at the end, and they do come in different lengths, but this is used for retracting and exposing. Our suctions, our Fraser suctions. Most of your suctions that are really tiny like this, they'll come with a stylet, and that's to aid in the operating room if there gets blood clots in there, that they're able to get them out easily. The pull suction tip, this happens to be a disposable one, but it has, I don't know if you can really see it here, it has a lot of the little tiny holes going up and down, and they like to use this when they irrigate the patient's abdomen because it'll suck out all the irrigation without sucking up the organs or the bowel. Our Yankauer suction tip is our most common suction tip used in most all surgeries. This happens to be a disposable one. Now we're getting into our needle holders. Our needle holders are our approximating category, remember, because this is what we're going to use. You only use a needle holder with a suture, right? That's the only reason why you need to use a needle holder is to sew up a patient. You're going to put a suture on the end of this. And it has these serrations at the tip because that helps it grasp onto the suture and hold on tight with it. And as you remember, you guys, that tungsten carbide, here's the gold handle. So the different types of needle holders, the Cryolwood was a little bit thinner. Okay, your Mayo needle holder is a little bit thicker tip. The Ryder is very small, so you're going to use it with smaller needles. It's thin. Your skin staplers, we had fun practicing with those, if you remember, but that is an approximation. Our staple remover, and sometimes they'll just use a Kelly. They'll say, give me a Kelly, and they'll remove the staples that way. Usually these staple removers are disposable items. Our Surgiclip applier. Okay, so this is going to be used to occlude, right? It's your Surgiclip applier. Oh, I jumped ahead in your book. We're on page, yep, we're on page 36. So it's used to occlude vessels and other tubular structures. So it's occluding, like our clamping and occluding, it's going to stop the bleeding. Okay, we're not cutting anything, but we're occluding them. They come in different sizes and they have different titanium clips that are in them, and these are a disposable item. Well, that's it for chapter 2. Go and take your little knowledge test that I have in Canvas for you, and I'll see you back for chapter 3.